Okay, I'm sure we're going to have more people joining us today, but I know it's the end of the school year as well, so some people may already be starting their vacation, and I don't blame you a bit. But thank you for joining us today for our Steps for Successful Secondary Transition Planning. And this is a special edition, a bonus for those of you that have been joining us on a regular basis for this series. And the topic today is going to be the move to adult healthcare. And I want to let everybody know that in your handout section, you do have this PowerPoint as one of your handouts. And you also have what's called the stepping stones, which we'll talk about later. But you do have those in the handout section if anybody wanted to click on them and follow along as well. So today, I am Diane Perry. I always am Diane Perry, but I am the Family Resource Specialist at the Peel Center. And some of you might realize that that name has changed. We used to be Parent Advisors. We are now Family Resource Specialists. And I am joined today by one of my awesome colleagues who's going to introduce herself, because that's why we have the bonus session today, so that we can tap into her area of expertise, which is so useful for many of the families that we serve. So Kelly, did you want to do a short intro?
Sure. So my name is Kelly King. I'm the Family to Family Health Information Center Coordinator at the Peel Center. And what I do is to help families who have children with special health care needs and those young people themselves with any area that relates to healthcare. And as you're going to learn here before too long, my perception is that everything that relates to children who have special needs is healthcare. And so that being the case, I say that my knowledge is a quarter of an inch thick and as big as the state, because we service the entire state. And the depth of knowledge that I have, varies in various subject areas. So sometimes I have to refer you out to somebody who knows a little more about it than I do. But it is a delight to join you today. I've participated in several of these Transition Tuesdays, so I'm honored to be asked to be a part of that. And I'd be thrilled to give you some additional information regarding healthcare in relation to transition.
Thank you, Kelly. And for those of you who may or may not be familiar with the Peel Center, I do want to remind you that this graphic represents the 6 key strategies used by Peel to accomplish all of our work. As you can see, the families and the youth are in the center of all of our work, surrounded by the communities and the professionals who work with them. And as you can see, those 6 areas are outreach, resources, individual assistance, training, leadership development, and partnerships. And we take pride in all of the partnerships that we have. And one of those is my partner that I've been doing all of these Transition Tuesdays with is Michael. Michael, take it away.
Thanks, Diane. So my name is Storr, and I'm a Knowledge Development and Technical Assistance Specialist with the National Technical Assistance Center on Transition, the Collaborative. I work out of the University of North Carolina, Charlotte at Cato College of Education. As we've been talking about, and just to kind of update folks, if you're new to our Transition Tuesday series, NTech the Collaborative is a federally funded project that supports state education and vocational rehabilitation agencies, local education agencies, school districts, and VR service providers, as well as youth, families, and other secondary transition stakeholders in developing and implementing effective evidence-based practices that help students transition from high school to adult living, with a concentration on looking at post-secondary education and training, competitive integrated employment, and independent and community living and engagement. I wanted to just go over quickly our objectives for today's session, or what we're going to be talking about, primarily what Kelly's going to be talking about, is we're going to look at a list of key considerations for healthcare transitions. We're going to discuss the important components of health and wellness, explore strategies to prepare for successful healthcare transition, and then finally discuss how healthcare fits into the overall transition process as well as the IEP itself. So I next wanted to just kind of do a recap. Diane and I have done 8 series starting way back in September, And just to kind of reiterate or review what we've talked about, because it does impact today's topic as we are now focusing specifically on looking at healthcare and transition. So as you remember, it's important, first of all, to think about age-appropriate transition assessments and really looking at both that individual's interests and preferences, but also that alignment to their needs and strengths, and then really how that helps to focus on what that young person is interested in doing once they exit high school, as far as going again on for some type of career or job in a certain area, what training, supports they would need, education to do that job, and then where they want to live and how they can most effectively engage in the community. Based upon that age-appropriate transition assessment, then we're looking again at writing post-secondary goals. And as a reminder, those post-secondary goals revolve around education and training, competitive integrated employment, and then independent living. We also then look at identifying, related to those post-secondary goals, what type of instruction that young person needs to engage with, what are those related services and activities, including those community experiences, and also those activities that they're doing both in school, out of school, that are supported by the school agents, providers, and families. In looking at what that student is going to be doing in school, looking at the classes they'll be taking for that IEP year, right, that they're engaged with in school. Also, keeping in mind and considering the connection and coordination with outside adult agencies that can support the young person while they are currently in high school, but more particularly once they leave high school. And then lastly, wrapping that up or looking at how that connects to that student's annual IEP goals that are looking at, again, addressing those students' needs, their skill deficit areas that they need to work on in order to be successful, again, to reach those post-secondary goals for further education and training, competitive integrated employment, and independent living. I'm now going to pass this over to Kelly, and she's going to take us on our journey looking at healthcare and transition. So Kelly, over to you.
Thanks so much, Michael. So again, when we are thinking about healthcare and health, I think that it's important to make sure that we're all starting at the same place. So I want to think about what health is. And if you look at this definition from the World Health Organization, it describes health as a state of complete physical, mental, and social well-being, and not just the absence of disease or infirmity. So it's not only about what may be wrong, but about staying well. So next slide, please. Today, I want to think about health in relation to the areas of transition. And when we think about those transition areas, so the education and training, the employment and independent living, I'd like to suggest to you that health fits everywhere. Hence the little, visual down there at the bottom. It flows into all of those areas and intertwines with them. And in my experience, next slide, please. Health has primarily been identified for students who have complex medical needs, and that's done within the independent living piece of the transition grid. But I want you to think, as we talk today, about the needs of all students with regard to health. And so this visual here, it really represents the ways that health and wellness can be divided, but they're just, ways that are categories to fit our desire to put things together. And in fact, health, it deals with body systems which are complex and connected and interconnected, almost woven together. So to separate these into these categories is really more of a problem than, but it's done for us to think about them. So you may not agree with the way that they're divided here and may say that, we should have had some additional categories or could have included things differently. That's okay. It doesn't really matter. It's just that I want you to understand this by dividing it so that we can weave it back together at the end. So I want to tell you a little story. And as I tell you this story, I want you to think about this situation. This is with regard to my own son. And I want you to think of the areas in which his situation touched these various aspects of health. So my younger son, Scott, played soccer in high school. And he would play for about 15 minutes, and then he would lean over with his hands on his knees because he couldn't breathe. And so, of course, gets pulled out of the game. So he doesn't get that competition, doesn't get that intersection with his friends, doesn't have that social piece, and goes to the doctor, and they check his wingspan, like how long his arms are from fingertip to fingertip, and they're doing all these measurements on him. So they send him to genetics. They send him to the cardiologist. They send him to the pulmonologist because clearly he doesn't have enough air to breathe when he's playing the game and he's leaning over. He's not gasping for breath, but he can't play the game. And so the geneticist says he's got a connective tissue disorder. And the pulmonologist says, oh, his lung capacity is great. Well, he's been playing soccer since he was, knee high to me, so that's understandable. The cardiologist says, well, there are some differences. The heart's still okay. So he goes back out and he's playing soccer in 15 minutes and he's leaning over and he can't breathe. He's a lot of interconnected systems, but he's a person. And so holistically looking at him and trying to figure out how we can help this young man to play soccer is really more of the issue. He's not just a bunch of systems. He's a person, and those systems are just a part of him. So when we think about his situation with regard to this, it had impact in a lot of these different areas. And in fact, he didn't get to play the last game of his soccer season in his high school career when they went, past the regular season because the coach knew he wasn't able to breathe well, and the poor kid didn't get to play. So yeah, that impacted him. It was kind of demoralizing. So again, I want you to think of these areas, and we'll talk about them in a little more depth in the next slide, but think about them as we proceed in terms of the students that you deal with, be it your own child or kids in your classroom, and how all kids need to know more about healthcare, but how we can use pieces of this in the transition grid in all three areas, whether it be a goal or in some of the activities that we design to enable the students to reach that goal. Next slide, please. So when we mention health, physical health is usually what comes to mind. That's what we associate with health, our body, our systems, and how we feel. We're top notch, we're under the weather today. Those are kinds of expressions that we think about when we think about how we're feeling at any moment. But I'd like to suggest to you that physical health is much bigger. For example, health-oriented behaviors. So that can be anything from the things that we do or don't do to contribute to our health, the sleep that we get, the exercise, nutrition, good or bad, making healthy choices as part of health-oriented behaviors. That would also include medical care, specialty care, dental, vision, those exams, the treatment, could be therapies. Another important part of that would be self-monitoring. If I don't know my body and my baselines, if I don't know the conditions that I deal with on a daily basis, how do I know when something is different or something is off and recognize changes in my body that may be impacting my physical health? Could the students that you work with fill out a brief health history? Can they explain their disability and the impact that it has on them? Do they know their medications, their dosages, when and how to take it? And what if it's not, doing what it's supposed to be doing? Can they have that conversation with their physician? Are they aware of their insurance information? Are your students aware of how to prevent accidents or illnesses? Do they know when and where to get treatment? Knowing when to use an emergency room or urgent care can be really important, especially, if you're paying the bill. When we think about abilities and limitations of our students, have we assessed their functional living skills in a way that really gives us an understanding of some of these issues? What are good and poor habits that exist, and what can we do to shape them up? How can we work in cooperation with the family, or the family work in cooperation with the school to address some of these things? And then, are the self-advocacy skills there for the young person to ask their questions? When I would take my son to the doctor, I'd start telling the doc about something was going on. He'd always correct me. I said, just, tell him yourself. He was a little shy in getting started, but boy, once I opened the door, he jumped in with both feet and took charge of that conversation with the doctor. So, are our young people able to make responsible choices about smoking, vaping, drug use, and are they led by, their friends or other people that are around them? Are they able to say no when they need to? Do they understand the importance of, water intake and I said, exercise and weight management, accident prevention and care? Do they know about ticks and when to wear sunscreen and how and what vitamins they need to be able to take? So lots of issues here. And the last one down there at the bottom is the health literacy. Well, I understand that lots of adults have issues with health literacy. It costs the nation, billions of dollars because of issues with health literacy, and not just monetarily, but the impact on health is really significant. So if adults, I think it's 70 to 75% of them have issues with health literacy. So if we have problems, you can bet our students are going to have problems too. But what is health literacy? So here's the definition. It basically is the ability to find, to understand, and to use information as well as health-related services in order to make appropriate health decisions. So if I have to decide whether or not to have this particular procedure, my son had to decide whether to do exercises or perhaps have surgery, and then thinking about the impact of that with his connective tissue disorder. Those are important. And there's a link on here to a video that I think you will find somewhat helpful, but a little bit humorous in understanding what health literacy is. Not to make fun of anybody, because this is an important issue. When we go to IEP meetings, we know that parents don't always understand the acronyms that are used, and the vocabulary of special education is different for people that are not familiar with it. Similarly, health providers use a different vocabulary than most of us use on a regular basis. So people don't often understand some of those terms. Pharmacy labels can be plain confusing, and at times, they don't seem to make any sense to us. Doctors sometimes tell us things when we're tired or we're emotional because we just heard some concerning information, and we're just not ready to listen. Sometimes it's just a matter of too much information being given to us all at once. And frankly, if you're like me, most of us just aren't comfortable saying, I don't really understand. Simply say yes when a physician asks if they understand. So how familiar are your students with medical terms, particularly those ones that are associated with any condition or conditions they might have? And then do they understand their prescriptions and when and how to take them and what they should be doing for them? Do they understand risks and benefits to procedures and why healthcare is important? So just one little example of health literacy. When the nurse tells you to push fluids, what does that mean? Go ahead to the next slide, please. Mental and emotional health is not measured by lab work, and sadly, those diagnoses are left to professionals who look at the symptoms and are noticing the ways that people feel, think, and act. And mental and emotional health issues can impact our moods as well as our behaviors. Now, some of that is, controlled by our genes. There's family history that comes to play, but our experiences and, in fact, our nutrition contribute to our mental and emotional health. Some of us have excellent coping skills and others not so good. handling stress and disappointment or some types of loss can come easily to some of us, but not so much to others. And eating or sleeping, those in and of themselves aren't bad things, but if we use those to cope rather than getting exercise or maybe practicing yoga or something like that, those not only impact our stress level, but they make a difference in our broader health as well. So a great deal of research has been done in recent years, perhaps you're familiar with it, about the gut-brain connection and how the microbes in our gut can impact our brain. There are physical, genetic, and chemical factors that influence and can disrupt that microbiome, and those can potentially impact our mental or emotional well-being. I also want to point out that the stigma that's attached to having a mental health condition has been problematic. Nobody wants to admit that in many situations, because people think there's something defective about you or that you're crazy. Some of the terms that we associate with it are not very flattering. So I'd like you to start thinking of mental health as brain health, for honestly, isn't that what it is? And when we think of this past year and having dealt with COVID, the worldwide public health situation, and the impact on all of us in ways that we never imagined, the toll on mental health, and particularly for young people, is significant. You can find loads of research about that. So it's really important to be aware of signs and problems and to know when and where to get help. And I could tell you some horror stories about some situations. It's never a problem to ask for help, and you're better to be safe than sorry in those situations. Go ahead to the next slide, if you would, please. You might choose to leave this with the mental and emotional health, or maybe you'd prefer to add cultural health to this category, and that's fine with me. Remember, these are just ways for us to better understand that health impacts everything. And we as human beings are social. There's lots of research out there around the value of social connections on health as well as longevity. Hey, we've got our BFF, our tribe, our pack, our buds, whatever you want to call them. We're interconnected, and that brings richness and wellness into our lives. But that's not to say that relationships don't come with challenges, right, Michael?
Right, definitely.
Yeah, we don't always see things the same way. We have our likes and dislikes, our skills and abilities, our talents and troubles. And boy, if we were all the same, that would be pretty scary, because boy, you would not want to be like me, let me tell you. And so having to do that social dance and getting our toes stepped on from time to time really helps us to learn as well as to grow. But we may need some help doing that in ways that are appropriate. And I want you to think about, as we're talking about transitioning youth, what transitioning to college or starting a new job, as some will be doing soon, might do to social relationships. We can't help but think of the changes from attending school on a daily basis with people that you've known for probably years, and then not having that daily in and out. Fall comes around and the school bus stops coming, as is said. Well, how do you keep those relationships going? And if those don't keep going, how do you start making new friends at either a new college experience or a training program or in a job? And if it's you that's not going off and other people are, how do you deal with that loss? And how are you going to make and build new meaningful connections? So understanding the nuances of this web of relationships of all different sorts, this again comes easily to some people, and it's hard work and downright confusing to others of us. So we can all use different supports to help us to navigate the social world. And it's important to be aware of possible problems, maybe through some assessments, and to recognize what we can do to help, to recognize safe and healthy factors And then, what can we do to address the problems or deficits that somebody might have? Once again, COVID put a big hit in our social relationships. Remote instruction, Zoom, takeout, curbside pickup, even telehealth. They all were put in place so that we could keep going, but they didn't address very well our need for social connectedness. Go ahead.
Kelly, I'm just doing a time check because I know you got a lot of material to get through. So I was just getting in here to keep it moving.
Thanks so much. So under spiritual health, life can be hectic. So this is really about having balance in your life and just, distinguishing your work hours, your home hours, friends, family. Make sure you're taking breaks, a little vacation if you can. That can be refreshing and satisfying and give you a new start. So having a sense of peace and understanding and how you fit into the big picture can be really powerful. Connections to your culture, as well as honoring cultural activities and celebrations, can really be huge and meaningful in your life. And then to many, linkages to communities of faith are a lifeline to those individuals. So it's really about life balance. Go ahead to the next slide, please. Intellectual health, I want you to think about what we can do to avoid graduating to the couch. And nobody finished high school knowing everything they needed to know. And your diploma isn't a tool to unplug from learning. It's important to keep challenged and have stimulating activities to expand your knowledge and skills. So think about this, things your students enjoy, whatever those are. Can they learn more about them? Can they explore their interests, pursue their passions? Our brain, like our muscles, needs to continue to be used. And what you've learned in high school is just the foundation for all the learning we have yet to do. Go ahead, please. Not all jobs are as safe as others, and while some of them aren't unsafe, they all have particular safety guidelines that are designed to keep us and everybody else around us safe and without injuries. Remember that communities are different, and some are more safe than others. There are people that live under electric lines that are impacted by smog. There's lead in their drinking water, pesticides and chemical exposure. I had an uncle who lived in Niagara Falls under the area called Love Canal, and he and his family were eating food from their garden that grew on those toxic chemicals, and they actually had goats and were drinking milk that the goats had processed from eating plants that grew there. They have, most of them suffered health-related issues as a consequence of that. So where we live can make a difference, and living in certain communities can create more problems. And who tends to live in those communities with more problems? The people who are less affluent, because they can't afford to live elsewhere, and those who are more affluent wouldn't want to live there. So, some other issues deal with emergencies. Do you know what to do in an emergency? Do you know how to get the help you need? And, get out in a flood, for instance, or, my house burned down when I was in high school. Do you have a plan in case there's a fire? COVID was a public health emergency. Even now, as things are opening up, are we using reliable sources of information? Do you know where to get a vaccine? Do you, know places that you can go and can't go, whether you're vaccinated or not, when and where you have to wear a mask? A lot of things are still unsettled and changing. That, of course, creates perhaps some anxiety and certainly some confusion for all of us. So check before you go. And lastly, disability laws and rights. The Americans with Disabilities Act provides a lot of protection for those with disabilities, but it doesn't help you if you don't know what's in there. Well, it doesn't help you entirely. Sure, we all benefit from curb cuts, but do you know what accommodations you need and what you can ask for, and what to do if there's a problem, and who to discuss that with to help you to tackle that? Go ahead to the next slide, please. Well, we'd all love to be able to have the things that we like, but we have to be able to afford them. So how do we budget and save? And what is the difference between a need and a want? And how do we be content with the things that we can afford and yet aren't the things we want? So if you want the iPhone and you can only afford the Android, are you willing to save up money to buy that? And where can you save in a safe way that doesn't risk your benefits? How much money can you have before your benefits are at risk? And, if you continue to live with your family, what is your responsibility to pay toward your household expense? So lots of issues there, and a lovely booklet that's going to be in our resources that helps with financial awareness and learning about some of those things. There are different kinds of insurance, and some of those are paid for your employer, and you have to help pay for some of those, but others are public insurance. And do you know things like deductibles and co-pays and what those mean and what those might amount to and how you're going to pay for those? And do you know what an explanation of benefits is, and who the bill actually comes from and what to do if you have a problem? Go ahead to the next slide, please. There are many ways to pay for medical assistance. So people that are getting supplemental security income, SSI, automatically get medical assistance coverage. That is for those who have significant disabilities. And if you have been getting SSI or you feel that you might be eligible for it, it's important to apply just shortly before your 18th birthday. But remember that even if you were getting it as a child, that had to do with meeting Social Security's eligibility criteria for a child. But when you become an adult, it's completely different. That has to do with employability, no longer just your disability. So do apply for it if you feel that you're not going to be able to be substantially gainfully employed. And that doesn't mean you can't work at all. It has to do, there's some specific criteria around that. But if you get denied, don't hesitate to appeal, again, if you feel that you're eligible, and get additional documentation for them to reconsider your eligibility for SSI. And remember that your parents' income no longer counts as you become an adult, but if you were married, the income and resources of your spouse would, but that may be changing under the new administration. So keep your eyes open for news about that. Remember, Social Security, supplemental security income does allow some work, and it may reduce some of the amount that you get, but working is a wonderful thing, and we want you all to be able to get out there and work. So don't think this is just about losing your Social Security funds. It may be reduced somewhat until you reach a certain amount of money, and with that you also get some additional things like the medical assistance coverage. Keep in mind though, if you're getting SSI, there's something called fair share, and you have to contribute to your household income. So if you're still at home with mom and dad and you're not helping to pay for what it costs you to live there, then that could be considered a gift, and that alone could reduce your Social Security funding. Go ahead to the next slide, please. This slide is about home and community-based services and waivers. And this is a really complex issue, so I can't go into it in a lot of detail. Diane's already, telling me I'm talking too much here. Got to speed it up a little bit. But understand that a lot of the services that individuals need after they reach 21, which were paid for as children under something, a component of medical assistance, called Early Periodic Screening, Diagnostic, and Treatment, EPSDT. That's just mandated under medical assistance. But those are gone when the individual reaches 21. And so sometimes a waiver is the only way to pay for some of the services that the individual continues to need. But waivers aren't automatic. There are some waiting lists for some of the waivers. So it's important, if you have an individual with an intellectual disability or autism, to register with the county. If they're found eligible and there is a need for support, then They're going to go on to a waiting list in all likelihood, and when funds are available, they may be able to get that waiver funding. On the other side of that, the physical disability support services, those individuals are typically funded through the community health choices, and there are a few under the OBRA waiver, which is for individuals with significant medical issues, and as soon as they turn 21, they move into community health choices. And the community health choices is actually a managed care. Those you apply through an independent enrollment broker called Maximus. And if you need to know more about some of those things, don't hesitate to give us a call at the Peel Center. Go ahead, please.
All righty, Kelly, I'm going to kind of take it from here, and
Excellent.
going to a little bit next about transition to adult systems of care. Sometimes you'll hear folks referring to healthcare transitions or transitions of systems, and really what this is the process. It's a transfer from looking at how an individual is being serviced in pediatric care to moving to an adult healthcare provider. So as you can see from this slide, there are some differences between visits at a pediatrician opposed to those at an adult doctor. Knowing these will help prepare that young person and their family for their next visit and to make these changes. Given these differences, when we look at this, it's important, one, to have that discussion, but then also look at what changes and what information that young person and their family needs to know. These, again, can be things that can be discussed as part of transition planning, because it is very different. As you'll notice, in a pediatric care, it really is more family focused. There's often, guidance done. The doctor talks to parents about the young person. There's a focus on development and care. In an adult system, it really is much more individualized focus. The doctor is going to be talking not to the family member, but to that individual themselves. And it really is a different process that takes place. So on the next slide, we look at our considerations when we are looking at this transition from a pediatric care provider to an adult doctor. So it's really looking at, making those changes. It's looking at, what is that individual's experiences. It's looking at not only location, but also what services can be provided and how much that new doctor or that practice is aware of individuals, and especially individuals with that specific healthcare condition or disability condition. If you look in the green box, some really good suggestions are provided there if this isn't something that the young person or family have started to think about. So if there's no ideas for an adult doctor, ask your current doctor for that practice. Ask other family members, what doctors they are currently using. Try them out. There is a process in place. It's called an operations memorandum or ops memo, and it can be a great process to transfer. And this is one of the resources I believe that we provided for today's webinar about the ops the ops memo. But it's really looking at, is the new practice, is it one that your insurance would help pay for? Are they accepting new patients? Do they offer telehealth visits? And is that something that makes the most sense for that individual? But I think doing research, doing your due diligence and exploration. A lot of the very large healthcare systems across the state of Pennsylvania do offer guidance and care, but it's important to check into this process and check into it early before the need actually arises. We had talked in several of the sessions that Diane and I have done over the last 8 months about different types of person-driven or person-centered planning tools. We talked about these when we were discussing assessment, but also in discussing activities and services and planning. We mention them here because it's really important when we look at person-driven planning to consider those healthcare considerations. So in looking at this and some of the methods that we have discussed, one was charting the life course And that's actually a person-centered planning tool that has been used in a lot of places across the state of Pennsylvania. But there are also a number of others, including maps and paths, using a positive personal profile. And as we have mentioned, for students, youth, and young adults that have mental or behavioral health needs, the resilience, empowerment, natural supports, education, and work or renew process is a great way of looking at what that young person desires for the future, all the considerations, including those healthcare considerations that need to be taken into account in order for them to be successful to meet those goals for the future. On this slide, we talk a little bit about planning and considerations for the future. And we mention these here because these are also items that can be addressed as part of secondary transition services and activities. They could be included in the IEP. They could be considered in looking at present education levels in the sections of the IEP. But it's also considerations for instruction that could occur, as well as activities and services. So when we look at these, does that young person have an understanding of how to maintain medications and a doctor's list, how to make their own appointments and fill out prescriptions? Looking at an understanding of diagnostic overshadowing. And basically what that means is looking at healthcare professionals and making sure that they're not making assumptions about the individual when they come in with a certain set of areas that they need to have addressed or complaints that they're having, and really to take into account the whole individual, not just and the symptoms, and not making assumptions. Looking at medical alert tools that could be used, as well as other areas such as considerations of power of attorney, having that young person, their family, understand about HIPAA rights and privacy, as well as looking at the best methods for communication. On this next slide, we list additional possible activities that could be included in transition planning, including help around applying for state ID, whether that's a driver's license or a non-driver ID in the state of Pennsylvania, using resources that exist such as healthcare checklists, and Kelly mentioned a number of those in talking a few minutes ago, looking at how that individual can arrange for transportation and mobility in their community, as well as looking at those independent self-advocacy, self-help skills. And with that, I'm going to turn this back over to Kelly.
Terrific. Thank you, Michael. It's love the way that you tied it into getting some of these things wrapped into the IEP. So when we think of health-related services at school, what jumps to our mind is the school nurse, because that's who we usually intersect with. But I want you to think that it's broader than that when I say that healthcare is everywhere. So we've got guidance counselors, we've got therapists who are sometimes in schools now. Some of the schools have health centers. There are also social workers and behavior specialists, whether those are from within the school or from an outside agency, as well as private duty nursing. So there's healthcare woven throughout the school district as well. And when we consider transitioning youth, again, think of issues that we can deal with to shape up some of these things in the IEP, just as Michael has already mentioned. Go ahead, please. And an important way that we can be doing that is through an individual healthcare plan. Those are called different things, but they basically are tools that address the individual's special needs, usually with a complex medical condition. So say the student has asthma, it can be an asthma action plan, or epilepsy. But what they are really details the condition that the student has and what needs to be done in case of a situation. It's much better and easier to address a situation in advance by addressing a trigger. If there's a peanut allergy, how to avoid those, and then what to do in the event of an emergency, so that everybody's on the same page and that individual gets the help that they need in a timely way. But remember, these tools can be made by the school nurse, but that doesn't have the legal backing of IDEA or the Americans with Disabilities Act. So if your child has an IEP or a 504, you want the healthcare plan to be infused into one of those documents to get that legal backing. And when a student has those complex needs, sometimes the nurse will always have a plan for the student, but that's not necessarily something that she shares with the whole staff. It's done in a different way. So sometimes doctors write these individual healthcare plans. I've even had families write them, and then they get the rubber stamp from the doctor and then are taken to the school for consideration and usage. So again, sometimes the nurse is an important factor in that, and you just need to keep lines of communication open to get these things addressed. Go ahead to the next slide. So there are times when a student has significant issues that the school nurse cannot give them. And the school nurse can't keep eyes on a student 24 hours a day, you know, from bus to bus, doorstep to doorstep. They need assistance beyond what the nurse can provide. And so if you have a medical practitioner, write the medically necessary script for whatever level of care the individual needs. For example, a lot of students with epilepsy have a private duty nurse working with them. Often those are filled by an outside home health agency, but districts sometimes contract to have a medically necessary service provided for one of their students. Unfortunately, when the student goes off to college or a training program or gets a job, those folks aren't going to pay for a nurse or a support person. So at that point, would be responsible for insurance to pay for that coverage, with the exception of perhaps a job coach or something like that that could be paid for by the school, and or the nurse if it was paid for by the school through the IEP process. But again, if those are needs that are going to be something that your student experiences in the future, it's going to be important to plan ahead so that they're prepared to have that support that they need going forward into whatever area of their life it comes next. Go ahead, please. So school nurses have a lot of jobs. You know, they're not just there to take care of skin needs. They're responsible for all of the students in the district, and sometimes they travel from building to building depending on the size and the spread of the district. And the job of the home health agency, which would be a medically necessary service, is to address that individual student's needs following the doctor's orders and the care plan for that individual student. They're not responsible for, nor should they be expected to deal with educational issues. And remember, if you've got an outside nurse, it's about communication with the folks at the school to make that you know, that dance as helpful as possible for the student. Go ahead, please. These are just some of the resources we'd like you to be aware of. The national office that I work under, Family Voices, is the first one. They've got a lot of great resources. Michael talked about the person-centered planning. I'd like to, if you're not familiar with, I'd like to introduce you to Life Course, just another of several types of person-centered planning. One thing important about that is that individuals that receive waiver funding are typically using the Life Course now through their plans. And then Pennsylvania Medical Home, which deals with the access to comprehensive, coordinated medical services through your practitioner. And then our friends at the Pennsylvania Health Law Project help people without charge who have public health benefits. If you got an issue with healthcare and you're getting public benefits, anybody of any age can give them a call, and they're experts and can help you out. Go ahead, please. And GOT Transition, they've recently, I'm not exactly sure when, done some modifying of that site, and excellent resources. Check it out. Do check it out. It's fantastic. This Michigan transition book is a favorite of mine. I really enjoy it. There are chunks in each area that are almost like an assessment for you to identify what deficits a student might have. So take a look at it. And I mentioned already the Sense and Sensibility by the Pennsylvania Assistive Technology Foundation, which really helps to understand wants and needs and limitations for public benefits. but that also has a teacher's guide, so check that out, and then some more information about Social Security. Diane, I believe I'm handing it to you, the baton.
Yes, you are. And thank you so much, Kelly. Oh my gosh, chock full of information here. I just want to remind anybody, if you have any questions, because I know that this is a lot of information around healthcare that Kelly and Michael are giving us today. So, you know, it's probably going to take a while to digest everything. And you do have that PowerPoint again. You can go into the handout section and follow that PowerPoint and, you know, click on those links, because lots of very good resources as well. So feel free to put some questions in the chat if there are any. I do want to remind everyone that this, when I talk to families, I tell anybody, when I talk about transition, I always say to the families, do you know about the transition conference? Because this transition conference is held every year, and it is simply amazing. When David was in school, I went, you know, like the first year without him, because I had to like get the lay of the land kind of thing. When we were in person, it's always held at the Penn State conference center there. So the first year I went, I got the lay of the land. Then after that, David came with me after a couple of years, because there are things for families, self-advocates, professionals. I mean, it has something for everyone. And it was a really good place for David to meet other youth across the state as well, who all have, you know, IEPs and experience disabilities and have support. So that is like a really wonderful thing. And he still has, since with a lot of those people that he met back then, even though he's 28 now, he still is connected to a few of them. But I encourage everyone to, I believe registration's open already. You go to the Patent website and you can register for this conference. It is virtual again this year. Hopefully next year we'll all be back in person, but it is virtual. And last year it was virtual too. And let me tell you, keynote speaker, as soon as I attended it, I felt like I was there in person. So even though it's virtual, it still has the power of what you can get from a transition conference. So I encourage everybody to attend that. Next slide. Here's another conference that is being put on in Spanish by HUNE, and they're an organization in the Philadelphia area that assist families who speak Spanish, and they're doing the whole conference. It's a day conference on July 13th. So if you or you know some families who speak Spanish, I think this would be an excellent opportunity. This is the first time they're doing it, so I'm sure it's going to be wonderful because they always have a lot to share with families. And just some reminders. And I know that we always try to talk about this, but even those best laid plans don't always work out, right? Let's use this past year as an example, right? So many things, you know, that we had planned, and we had this pandemic that we had to pivot here, pivot there, you know, and do all kinds of things. So lives change, you know, situations change. So I know it's hard for some people to be so flexible, but you know, I do feel like what I forget what that toy is that just kind of all around that I used to play with all the time. I feel like that as I went through special education with David, you know, because it's just, okay, we got to be, all right, I'm going to do this now, you know, those kinds of things. So the biggest thing is you're not alone, right? You have lots of families, other families out there for support, professionals, the Appeal Center, other agencies, NTEC. There are several places. You are not alone during this transition phase. And do remember, just keep asking questions, just keep showing up. And I'm going to tell you, yes, it's complicated, and yes, it is a lot, but we can all get through it together with all the resources.
Hey, thanks, Diane. As I mentioned at the beginning, we were talking about the National Technical Assistance Center on Transition, the collaborative. We are a newly funded center, and we are still putting the final touches on our website. But if you go there, you'll actually see the new website. You can find resources that are there. We're still in the process of updating. But we also, I just want to remind folks, you can either send an email to me directly, or if you have questions for NTAC, the collaborative, you can send them to the email address that's listed there. It's ntac-collab@uncc.edu. And as we've been mentioning over the past months, If you haven't done so already and you would like to receive our weekly email blast regarding current secondary transition resources and activities, please sign up, and you can find it on our website, which is transitionta.org. And again, thank you for joining us. I'm going to turn this back over to Diane to bring us home.
Okay, it looks like we're going to have a quick poll first here. And did you learn something new today? If you could just click yes or no, that will be helpful for us moving forward. And then I will bring it in for a close after we do this poll real quickly. I think Kala is helping with this in the background for me. In the meantime, I do see a question. Really looking for opportunities for youth to connect directly with one another while navigating these things. Similar to the Penn State Conference, but local, weekly gatherings where they can encourage one another, hoping to find something like this. So I know, oh, and there's another question on your screen. Will you share this information with others? Yes, no, or I'm not sure. Jen, to answer your question, I would say that in the, I believe we have shared transitiondiscoveries.org. There is a section for youth in there that would be really helpful. As far as connecting as well, you have the Pennsylvania Youth Leadership Network. And at the Peel Center, we do have the coffee houses, youth, the coffee shop thing, I forget what the actual name is, but it's like every Thursday at noon or something like that. You can go to the Peel's website and click on the youth activities, and you'll be able to see all the information around that as well. Michael, do you have any other suggestions?
Well, I think in addition to Transition Discoveries and the Pennsylvania Youth Leadership Network, just checking with your school district themselves and their transition coordinators, because oftentimes there are connections within the school itself where they have events or they're connected to other schools. There's programs through Special Olympics, through Best Buddies, that individual school districts throughout the state have. So I think, as Diane mentioned, Transition Discoveries, that website we've mentioned on all the past webinars, the Pennsylvania Youth Leadership Network, reach out to them, but then also just check locally within your own school districts, I think would be helpful.
Absolutely. Thank you. All righty. So, wow, with that, I think we just ended our last session, Michael. And Michael and I are brainstorming that we might bring something to our viewers in the fall. We're not sure what that will look like, but hopefully you will see something. And if so, you want to continue to come to the Peel website. We want to thank everybody for joining us today. And for those of you that have been joining us throughout this whole series, Peel Center information is there as far as how to contact us, our website, and you can send us an email or simply give us a call as well. So I'm very happy to be able to bring all this information around transition to everyone, and it's a pleasure working with you, Michael.
Great. Thank you all for joining us. Thank you for the great information today, and you all have a great rest of your day. Take good care.
Thank you.